Let's do a little review on Chapter 16, your Radiology Coding Basics. What is radiology? It's a branch of medicine using imaging techniques to diagnose and treat disease. A radiologist is a physician with specialized training that can interpret diagnostic x-rays, perform specialized x-ray procedures, and in some cases administer radiation. Your subsections of your radiology chapter in CPT is divided into diagnostic radiology, diagnostic ultrasound, which also includes your ultrasonic guidance procedures, your radiologic guidance, which encompasses fluoroscopic guidance, CT guidance, and magnetic resonance guidance. Radiologic guidance is used in procedures for guidance for placing, replacing, or removing catheters, needles, central lines, and localizing an abnormal mass or tissue and needle placement, so that way when a surgeon goes in to operate, they know where they're going. Radiation oncology is the use of radiation to treat malignant neoplasms, and nuclear medicine is the use of radioactive elements used in diagnostic imaging or to treat diseases with radiopharmaceutical treatment. If you've ever heard of radioactive iodine, that is encompassed in nuclear medicine, and destroys thyroid tissue in cases of hyperthyroidism. Let's briefly review some radiology terminology. First, you have your planes of view, and basically that just describes the planes that separate the body structures, and that's divided into 4 different sections: your frontal, which is coronal, mid-sagittal, sagittal, and then your transverse, which is horizontal or axial. More radiology terminology, and this is really a play on words, is your positioning and projection. Your positioning and projection is how the patient is positioned in order to take the film, and the projection describes how the X-ray beam travels through the body. So you have your anterior, posterior. The projection goes from the front to the back. Lateral is that just a side view. Oblique is a slanted sideways angle, and then you have posterior, anterior, which is abbreviated PA. Okay, now just a listing on the next 2 slides of your different radiology procedures. Let's see if we can have a play on words on all of these. You have your angiography, aortography, arthrography, your CTs, which is a computed axial tomography, computed tomographic angiography, CTAs, cystography, fluoroscopy, MRIs, nuclear imaging, PET scans, which is positron emission tomography, SPECT scans, single photon emission computerized tomography, ultrasound, venography, X-ray, and that's your different sections.